Good afternoon. Here we are with COLLive.com. We have the honor and pleasure of having Dr. Zev Zelenko from Orange County, New York, who has announced and educated the masses in this crazy times of some new innovative solutions for the coronavirus. Is that correct, Doctor?
Hello, Shalom Aleichem. Is that correct? What I did was take some existing information and existing medications, put them together in a creative and novel way, and more importantly, started using them early in the disease process. And the results have been extremely positive. So for example, I combined information presented from the Far East, from South Korea, where they were using hydroxychloroquine and zinc. And I combined that with the study from France, which used hydroxychloroquine and azithromycin. And the data was promising, so I figured, let me make a 3-drug regimen. And more importantly, and it's currently being used in the intensive care units in the hospitals, at least in New York. But my idea was, let me try to implement this treatment in the outpatient setting when the patients are still not so ill. And the results have been excellent. So I don't give it to every patient. These drugs are not candy, and they have some potential heart rhythm issues. However, that's a minor issue, and in the right patient, it's worth the risk. So if someone is young and healthy, and they have no medical problems, and they have no problem breathing, the statistics are that 99% will get better. There's no need for treatment. There's no need to take the risk of heart rhythm issues. However, in the high-risk population, the risk of death, depending on which country you look at, is between 6 and 10%. So high-risk population is defined as more than the age of 60, people with chronic medical problems, immunosuppression, and those subset of patients I treat very aggressively, very early. And so far, I've been doing it since last Tuesday. I've only had, unfortunately, only one patient admitted to the hospital yesterday, and he's admitted with pneumonia, but he's not on a ventilator. He's breathing on his own. So I think he's going to get better without intubation. So let me tell you what the problem is. Let me explain the disease process, and then explain how it works and why it's so important to treat early. It's really two diseases.
Tell me one thing. Does it actually cure it, or it takes care of the symptoms?
Well, I was about to explain that.
Oh, great.
First of all, I don't actually know. And I'm not claiming to find a miracle cure. I'm giving you a frontline battlefield report of what I've seen being on the front lines. And the observations are very positive, and they need to be investigated. But at the same time, since millions of people are dying around the world, we don't have time to spend 6 months to 12 months doing a study. It should be done, but simultaneously, in my opinion, these drugs should be initiated as soon as possible. I was contacted by Mark Meadows, the current chief of staff of President Trump, and he has my protocols, and they're evaluating them. And actually, yesterday, Vice President Pence announced that hydroxychloroquine will be made available for any patient in this country, even though it's considered experimental. The FDA approved it. And I want to thank President Trump for his guidance, and he's really had, his instincts are very right on, in my opinion, and he's making this drug available, and it's going to save a lot of people's lives. But let me just explain to you. The virus, the main problem with this virus is it damages the lungs, and if the damage is severe enough, the lung tissue releases poison, really. It's called cytokines, but it releases poison and destroys the lungs from the inside out. And that's called acute respiratory distress syndrome, or ARDS. Those patients get intubated, and 50% of them die. So the whole name of the game is to stay off a ventilator. not to need a ventilator. I agree the country should make more ventilators and more beds, but it would be much better to treat someone early and eliminate the need, mitigate the need from going to go to the hospital. Anyway, the hospital's overrun right now. So it's impossible to get care on time if you go to any city hospital right now. So what I've done is I take hydroxychloroquine, and the way it works, it opens the door for zinc to get into the cell. Viral replication happens within the cell. So a virus gets into the cell, hijacks the cell's machinery, and replicates. Zinc stops that, we believe. However, zinc doesn't want to get into the cell for biochemical reasons. What hydroxychloroquine does, it opens the door. That's all it does. It opens the door, zinc could get in. Once zinc gets in, it begins to affect or slow down viral replication. And it's a race. It's a race between a person's immune system and the virus's desire to destroy the lungs. The whole idea is to decrease the viral load that the patient has, giving the immune system time to overcome the virus before the lungs are damaged. And the rationale for the antibiotic, azithromycin, I believe, is to prevent secondary bacterial infections. So the combination of the three seems to be very effective. And like I said, since I've treated now many hundreds of patients, and I've only had one patient admitted in the hospital.
Because of your spin on this, or take professional, are you getting patients from other cities because they hear what you're saying? I'm just curious.
The whole world is calling.
Amazing. What I find very interesting, as I've now in the media the past week, and I find that leadership in general, whatever level, they're all afraid to talk. When I first saw your video, I actually read your book a couple of months ago. Great book.
Which book?
The Faith, Your Story, How You Became Religious.
Metamorphosis.
Great book.
It was called Metamorphosis. It's my autobiography. But I also wrote another book recently. It's called Essence to Essence.
So I read Metamorphosis a couple months ago, as I'm a friend of Yoel Glick, the artist. I also operate an art gallery, so he says, "Oh, make sure to read the book."
He was my chavrusa. We used to learn iron bass together.
Wow, he's a special man.
Yeah, time for an amazing story with him. You'll appreciate
Sure.
it. So after learning a few months with him, he asked me if I can get him a Rebbe dollar. And I said, well, I only have one, but I'll try to get you one. I'll see if I can. The next day, I'm walking out of the mikveh in the big Satmar Beis Medrash in Kiryas Yol, and I see a friend of mine sitting collecting money for Hatzalah. So I'm in Hatzalah, so I sat down next to him, and I started, collecting money. And someone comes up to me, a patient of mine, and says to me, I want to give you something. And he gives me $1, and it says in the dollar, Yud Beis Yud Gimel Tammuz, I forget which year. And he said to me that he was in Manhattan and he bought something and he got change, and he noticed that the change that he had was written, so it was a Rebbe dollar. So I called up Yoel Glick. I said, listen, I have a special delivery for you. The Rebbe just sent you $1.
Unbelievable. So the fact that, being in the media, I was saying, you need to get statements from leadership. So I'm going to this person, that person, this doctor, that doctor. They're all not answering the phones, are afraid to talk. And suddenly I see your face pop on social media saying, and actually having a doctor with an opinion, with his calm, and was very impressive. I got very excited. Then I heard your thing, and then from there it clearly went viral to Sean Hannity, to the president, to all these crazy situations, reached amazing places.
My understanding is currently on the way to the desk of Bibi Netanyahu, the protocol.
Question. Since I know you have a compromised immune system and you're not practicing in person, but over the internet or phone, wherever you're doing, do you think that gave you a different perspective on the coronavirus because you were not in the thick of things and therefore you have time to think about a solution, or not at all?
I actually was in the thick of things, and my wife made me stop. So that's why I've quarantined myself. And my children were very nervous for me. So, no, I try to think globally. So I've been very busy. You can't imagine how many phone calls I get every few seconds. It's quite overwhelming, actually.
So
And
what, in general, I'm not a doctor. Why is it that doctors in general, they're slow to come and think out of the box and find solutions? And clearly you're not one of those people. What is it about the medical field that people are so afraid to say this? And I saw a bunch of letters against you and videos, and I didn't see any substance to any of those letters or videos yet. But why is it in the medical field people are so, I guess, sheep mentality? Is that the right word?
yeah, I think you're being a little too narrow. It's not only in the medical field; it's in the whole world. The world is permeated with Katnas. I call it pitsy brain syndrome, and that's the problem. That's the whole Golus Mitzrayim is Moichem the Elakim. We need Moichem the Havaya. We need Moichem the Godless. We need to think in a broad way, and broad way means you're comfortable with what you believe, but you can listen to other people's opinions. You can learn from them. You can integrate them. So, and it's also important not to do it for your own ego. After what I've been through with my own personal health issues and almost dying, and so I look at life very differently, and all these like public accolades, they're not so important to me. It's more important to leave a meaningful impact on the world, and to help people, and to help bring Mashiach.
Are people, I mean, it's in this world, unfortunately, negative sticks out more than positive. Are most people in the medical world supportive of you, or mixed 50-50 of your approach to this whole coronavirus?
Oh, initially everyone's against. People are, I can't figure it out really. Is it because they're afraid of liability? Or they're thinking about themselves before the patient, perhaps, or it's jealousy, or whatever it is. But the natural impulse of someone when they hear a new idea is to denigrate it and so on. I think there's room in the world for everyone to prosper and for everyone to come up with beautiful things, and a person's success doesn't take away from anyone else. So. I don't know if that answers your question.
I saw a letter by the KJ, I don't know, emergency service something. Would you want to comment on that thing? That
I will let you do your own investigation, but you could just check the pulse of the population of KJ. I'm not referring to I'm referring to the majority of the human beings that live there, the wonderful, beautiful Yidden that I've had the chus to be a doctor for the last 17 years. Maybe you could ask them what they think.
I remember when I spoke to Yoel Glick about you, because it's an interesting phenomena to have a Lubavitcher who, I guess you probably wear Yechiamaka still, doctor?
Depends on my mood.
In the ghetto of ghettos of ghettos of the Satmar community of the world, I remember asking, like, Yoel, how does this all work out in Middle Monroe to have such a doctor? He says Dr. Zelenko is very comfortable and proud of his beliefs. And he says not always do everyone connect to him, but those who appreciate the MS definitely connect to him. But clearly, I guess it's like the fact that you could do that and you have the whole world commenting and some of them even attacking you, I guess you're comfortable of not being Mr. Popular at day one, perhaps.
Yeah, again, the only thing that has chen in life is emes. And if you try to make everyone happy, you know what happens. So, yeah.
Right. What else? I heard one person, there's an Instagram lady, her name is Chani Applebaum. She just posted today. She's like, I don't know, 50,000 followers, very popular from Chabad lady. She said she's trying these Dr. Zelenko potion and it hasn't been effective yet. Does this thing work for everyone? Not necessarily. What's your take on that?
I have no way to answer her. I don't know what doses, what she's taking, when she started it, if she really has the disease. There's too many variables. And of course, it doesn't work for everyone. You have to use it in the right population. at the right time.
Okay. What?
But I wish her well. She should have a foolish language.
Um,
Wait 1 second. The fact that she's still talking and doesn't have a tube in her mouth, that's a sign of success, I would say.
I was just from today. My wife mentioned, "Oh, Moshe, I know you're going to interview Dr. Zelenko, so just mention this lady. What's your take, etc." Like you said in your first
success. I need to define what success means. Not dying, not getting intubated. That is the success. I didn't say it's going to make you feel better. You're going to be miserable for 2 weeks, blah, blah, blah. But that's the end game.
And this idea came from your own innovation, or is it came from overseas and other people are using it and they heard about it and you implemented it immediately?
Again, when you say my idea, what do you mean? Which aspect?
The fact that you mainstream this solution, whatever you want to call it, I don't know the medical word.
My idea was to bring it out of the ICU
into outpatient.
And that's my idea, that's for sure. I don't know anyone else who was doing it. Maybe they were, but I'm not aware of it. And my idea was to combine the Far East approach with the with the France study, make it into a 3-drug combination, and use it all at once at modified outpatient dosing.
Wow, incredible. Thank you so much for your time, Dr. Zelenko. And more impressive is that you actually took a stand and made a point, and you're thought out of the box. You thought you're the first person I heard from speak publicly at a specific solution to the coronavirus that gave people a huge sense of relief. So that in itself is incredible.
I hope it pans out to be helpful.
And clearly, after you mentioned, or I don't know, Trump mentioned after or before, I don't know the exact timeline, but there became a shortage of them. Is that correct?
Yeah, I actually saw that coming, and I stockpiled, not me personally, the pharmacies in Monroe. So, but I'm running out now, so like everyone.
Right. And the medicine that's coming from Israel, are these medications or other ones?
No, it's that. Teva donated 10 million pills of hydroxychloroquine.
Was that after your statement, or?
I don't know.
It just happened all at the same time?
Well, I don't know when it happened. I know President Trump made the announcement that there was a positive study out of France. He has a good feeling about this drug, and he wants to implement it. And he got a lot of flack for that, but I think he's right on in many ways.
Do you have any perspective or prediction of how long this thing will last, or is it just a virus that will last forever?
You have to understand, everyone's going to have to get it.
Like chickenpox?
Or become immune with a vaccine, because now it's arrived. It's not going away. So everyone has to develop an immunity to it. The problem is, if everyone gets sick at once, which is happening now, people die because of lack of resources. So if everyone got it over the next 3 years, the small percentage of people that get really sick, we would be able to manage them, and we wouldn't have such a shortage of resources. That was the whole idea, flatten the curve idea. That the whole idea was to slow the spread so that not everyone gets sick at once.
Final question. What do you think about the idea of just quarantining the old people and let the world restore back to normal and people be a little extra careful, and that's it? Like people are implying, or Trump is suggesting. What's your medical opinion about that?
That's short-sighted, because while quarantine is important, you need to do something during the quarantine. Otherwise, you need to increase the capacity of the medical system to handle the sick people. Because if you're quarantined, and the second you break quarantine, you go out into the public, it's going to surge again. So the whole idea is now we buy some time to get more respirators, to get more beds. The best case estimate in this country is 1.1 million dead people. Worst case scenario, 2.4 million dead people. Now, it's true, these people many of them were going to die anyway because they're old, but this virus helps them exit early. And who wants that? So it's not a joke. I mean, and people did not take spread precautions. I know exactly what was going on. They didn't take it seriously.
Okay. So the idea, and you're just very too informative. I'm getting too many last questions here. So over 60 is the much higher risk of them dying or getting sick? Dying. So under 60, your health immune system at 35 years old, what's the likelihood it will bring you to the hospital? If you're 35, healthy, zero medical issues that you know about?
1 in 1,000.
1 in 1,000. Okay.
That's why, let me say this to anyone who's listening. If you're young and you're healthy and you have no medical problems, you need to relax. Anxiety and all this hysteria is not good for anyone, number one. It shows a lack of emunah, in my opinion. And also, the statistics are on your side. Relax. You don't need the medication. You don't need to take the medication away from people who really need it. Yeah, you're 35, you take a medicine, then I don't have for your grandmother, you know? So it's a problem. So you have to relax. You'll be fine. And we need to focus our energies and resources on the vulnerable population.
Right. That's one of the people who had questions about your theories, like, oh, it's going to take away from the people who really need it. So you're clearly addressing that the young people should not be jumping and taking the people who really need it.
I said that in the beginning. If you're young and healthy, I do not treat you. There's no need to treat. The statistics show you will get better. You will be miserable for 2 weeks, but you're not going to die.
Okay. Thank you so much, Dr. Zelenko, for your precious time.
Let me end with one thing. I saw a nice gematria. The corona is gematria Mashiach Ba.
Wow. Thank you so much for your time, Dr. Zelenko. Here we are. Moshe Frank for COAlive.com.
Bye-bye.